Dr. Holly Rizzo here. Welcome back to our series in pediatric dentistry. Today we'll be discussing dental anomalies part 2. So we previously covered other dental anomalies in part 1 of our discussion. So in part 2, we'll focus specifically on 8 common anomalies of dental structure. So let's move on to the first one, which is enamel hypoplasia. So, enamel hypoplasia is a condition characterized by underdeveloped enamel tissue resulting from a disturbance in the apposition stage of tooth development. Do you remember the apposition stage? This describes the deposition of mineralization of the hard tissues that cover the tooth structure, including dentin, enamel, and cementum. So, any disruption in this stage would affect the overall structure of the tooth. One specific type of enamel hypoplasia is Turner's hypoplasia. This type of hypoplasia typically occurs following an infection or trauma-induced inflammatory response to a primary tooth. This disturbs ameloblasts that develop the permanent teeth, leading to an underdevelopment of enamel. Turner's hypoplasia only affects permanent dentition and is seen clinically as a brown tinge on the affected tooth. Notice the central upper incisors in this image. Another form of enamel hypoplasia is associated with congenital syphilis. This is a condition transmitted from an infected mother to her unborn child. So there are two distinctive dental manifestations of congenital syphilis, and that is Hutchinson's incisors and mulberry molars. So Hutchinson's incisors are characterized by a hypoplastic triangular notch on the incisors' edges, and mulberry molars exhibit a globular rounded enamel cusp on the occlusal surfaces of the molars. Next, we'll discuss enamel hypocalcification. This occurs when there's a failure in the maturation stage of tooth development. The maturation, which follows the apposition stage, is crucial for the completion of enamel mineralization. Any disruption during the stage can result in abnormal mineralized enamel, which is weaker and more porous compared to healthy enamel. So it's often clinically seen as white spots of an abnormal mineralized enamel. Notice how the white spot here on the upper left central incisor. We can see that it is white and chalky in appearance and tends to have this kind of tannish, whitish cream color. These teeth are more prone to sensitivity, decay, and often erosion. Next, we'll discuss Amelogenesis Imperfecta. Amelogenesis Imperfecta is a genetic condition characterized by alterations in enamel formation while the dentin and pulpal tissue remain unchanged. It arises due to a disturbance in the Bell stage of tooth development. This disruption affects the subsequent stages of enamel formation, leading to the characteristic thin or absent layer of enamel observed in individuals with this condition. It affects both the primary and permanent dentition and is divided in 3 different types, which is hypoplastic, hypocalcification, and hypomaturation. So the first type is hypoplastic amelogenesis imperfecta. This occurs when there is a defect in the quantity of enamel. The enamel is very thin, but it is hard, but this is the most common type. Type 2 is hypomaturation. This occurs when there's a defect in the maturation process of the enamel. This is where there's a normal thickness, but this is soft enamel that can wear away easily or break. And the final type is type 3. This is hypocalcification. This is when there's a defect in the initial stages of formation of the enamel. So the enamel may have a normal thickness, but it's typically quite soft. Next, we'll discuss Dentinogenesis Imperfecta. This is a genetic autosomal dominant condition that affects the formation of dentin in teeth. So in this condition, the dentin forms the bulk of tooth structure, and this is the part that's affected. In this condition, the enamel can easily separate from the defective dentin, leading to enamel loss or detachment from the underlying tooth structure. Notice how the enamel is lost in this picture. Just like amelogenesis imperfecta, dentinogenesis imperfecta is inherited as an autosomal dominant trait and also causes disturbances in the Bell stage of tooth development. So dentinogenesis imperfecta has some common radiographic features. Some of these include short roots, which we can see here. We also can see a constricted DEJ, which we notice here, an obliterated pulp chamber. You can notice how we cannot trace the pulp chamber here, and bulbous or bell-shaped crowns, noticed here. So similar to amelogenesis imperfecta, dentinogenesis imperfecta affects both the primary and permanent teeth. Additionally, similar dental changes may be observed in individuals with osteogenesis imperfecta, which is a genetic disorder characterized by brittle bones. One key feature of osteogenesis imperfecta is that it's often tested on our exams with the presence of blue sclera of the eyes. So next we'll discuss dentin dysplasia. This also alters dentin and may be inherited as an autosomal dominant condition. This condition can affect both the primary and permanent dentition. So there's two main types of dentin dysplasia. We have type 1, which is radicular, and type 2, which is coronal. So let's start with type 1 with this image on the top. So type 1 affects the radicular dentin of the teeth, resulting in short roots and chevron-shaped pulps. This is often accompanied by a premature mobility and exfoliation of the teeth. Loss of organization of root dentin can also be found, but the enamel and dentin are clinically normal. So again, these teeth may develop tooth mobility, premature exfoliation, and malalignment. So let's move on to type 2. Type 2 is coronal dentin dysplasia, which affects the coronal dentin and is clinically determined by its thistle-shaped pulps, bulbous crowns, and thin roots. It can also be considered a form of dentinogenesis imperfecta. So treatment options for these conditions are limited as these teeth are not well suited for proper restorations. Next, we have regional odontodysplasia. So this is a condition that affects the formation of enamel, dentin, and pulp tissue. As the term suggests, the condition is regional, affecting specific regions and typically quadrants of the dentition rather than the entire mouth. It's typically characterized by ghost teeth as seen in this x-ray. So some common features of odontodysplasia include short roots, open apices, and enlarged pulp chambers, which we can see here in this radiograph. This affects both the primary and permanent teeth. So treatment includes supporting eruption to promote healthy alveolar bone and then extracting affected teeth once the teeth are erupted. Next, we'll discuss concrescence. So this can be characterized by the union of adjacent teeth by cementum overlying the roots. Look at how these teeth appear that they're glued together. So it's commonly associated with hypercementosis, which is an excessive deposition of the cementum. This dental anomaly can lead to various complications, including occlusal disturbances, difficulties with eruption, and challenges for extraction procedures. The prevalence is about 0.04%, and it's most likely to affect the maxillary second and third molars. Finally, we'll discuss enamel pearls. So enamel pearls can be defined as ectopic globules of enamel typically found on the root surface of the teeth. And we can see one right here in this furcation area. So the presence of enamel pearls consequently blocks the attachment of Sharpie's fibers. This can result in periodontal pocketing, exposing the tooth roots and making them more susceptible to localized periodontitis and other dental problems in these areas. This may be involved with the enamel only, or these may actually contain dentin and pulp tissue. Enamel pearls typically appear round, white, smooth, and glass-like, and can affect a primary and permanent teeth. It's most likely to be affecting the maxillary second and third molars as well. Treatment for this includes supporting eruption to promote healthy alveolar bone and then typically extracting affected teeth once they've erupted or monitoring these. So now that we've discussed, let's talk about some questions. So let's start with example 1. Each of the following is a type of amelogenesis imperfecta except one. Which is the exception? So go ahead and feel free to pause and think about this question. So the correct answer to this question is option B, hypodontism. This is not a type of amelogenesis imperfecta. The different types of amelogenesis imperfecta include hypoplastic, hypocalcification, and hypomaturation. Let's move on to the next question. So example 2, we have an 18-year-old male whose chief complaint is that they don't like how their teeth look, and the patient has fair oral hygiene. Current findings include a full dentition and blue sclera of the eyes. And here we have this radiograph as well. So which is the most likely dental condition found for this patient? So feel free to pause and think about this answer. So the correct answer to this question would be option B, Dentinogenesis Imperfecta. The X-ray shows common features of Dentinogenesis Imperfecta, including a constricted DEJ, obliterated pulps, bell-shaped and bulbous crowns, and the patient has blue sclera noted in the current findings. For our last question, we'll discuss this 15-year-old female whose chief complaint is that they're missing teeth. Background and patient history includes good oral hygiene, a non-smoker, and no previous restorations. And current findings, we can see that there are missing teeth in the third quadrant of the mouth. So based on this panoramic x-ray, which is the most likely dental condition found for this patient? So the correct answer to this question would be option C, regional odontodysplasia. This panoramic radiograph shows ghost teeth in the third quadrant, which is a common feature of this regional odontodysplasia. So to summarize today, we've discussed dental anomalies of the structure, including enamel hypoplasia, hypocalcification, amelogenesis imperfecta, dentinogenesis imperfecta, dentin dysplasia, regional odontodysplasia, concrescence, and enamel pearls. Thanks so much for joining today, and we'll see you next time in our series.